I know we were kind of jumping between cases, so I'm going to just go back to case number one here because I don't think we did this one because I wasn't able to log into the platform earlier. So case number one, if we want to go back, tell me, oh, sorry, that's, is anyone else on Duolingo? I'm on Duolingo and early bird chest available. How appropriate. Trying to learn Spanish for anyone that might want to teach me Spanish, find it quite difficult. Okay, so let's have a look at the skull X-ray. And so what you do, I mean, you've got two views here, right? You've got your sort of more sort of direct view, and you've also got your OM view. And actually, generally speaking, I do sort of just jump straight to this one and try and glean as much information as I can. So when you zoom into this, what I would say, I don't know if you guys can see this, and I always find this quite a useful thing to do, is have a look at the soft tissue here. Can you see that soft tissue there? Okay, so I'll go through number two as well. So you can see the soft tissue there. And actually here, can you see that that looks a little bit sort of bigger, doesn't it? It looks like there's some inflammation located within that region, right? And so someone might say, oh, is it mucosal thickening? The thing is, look, this person's got very, very big soft tissue swelling. And I wouldn't really, mucosal thickening would be within the axilla rather than within the region. Or someone said within the, are they saying, so let's have a look. They said mucosal thickening within the frontal sinuses. Is that right? Frontal sinuses are over here and over here, and they look pretty good. Let's go to this one and see whether we can see any definite mucosal thickening. I wouldn't really bank on it, really, personally. But what I can bank on is the fact that this patient's got quite increased soft tissue density over here, right? Quite unusual because normally so this is the right side and that's the left side. So normally when someone gets an injury or get punched in the face, they get punched on the left side because someone is normally right-sided when they're getting punched right-handed. But this is left-sided, so I'm speculating. I'm not saying they were in a fight, allegedly, maybe not. But you've got to look at now. So this is where you've got to start focusing, like what could be going on here. So then when you go back to the sort of more AP view, one of the things to do is to have a look at these areas over here. Just make sure there's no obvious air located within the orbital region. So someone said it right there. There is some periorbital soft tissue swelling. And actually now when you look on this view, this area just looks far more dense than that side, doesn't it? It just looks much more dense. And then you've got to start looking at your sort of more typical areas for where you'd get injuries. And the way to do that, in my humble opinion, is to draw along the inferior orbital wall, see if you can see any obvious abnormalities. I can't say that I can 100% say that. Lateral sinus wall looks okay. And then you've got to go for this sort of elephant. So a lot of people talk about the elephant. Elephant trunk is over here. Elephant trunk is over here. So on here, it looks slightly weird to me. So then it's better to go across to this view. Let's zoom in and see what's going on. And actually, it doesn't look quite right. Can you see that? That looks a bit funny there. That looks a bit dodgy there. It doesn't look like it's quite lining up. So I would have thought that this person's got a left zygomatic arch fracture. So very, very important. If you see that, you've got to look for this one and this one, because then you'd be looking at a tripod fracture. But I don't think we can say that as a tripod fracture. The maxillary sinus doesn't look like it's particularly opacified. So we're not looking at an orbital floor fracture where that would be like, when you get a trap door and it just opens up like this, like boop, and then like a whole lot of orbital fat comes through it. I don't know. Does anyone watch boxing these days? There's like Kell Brook back in the day. He got fractured on both orbits actually. On two separate occasions, two separate fights, and he had to put some metal along the bottom of there.